Sure, and as we're heading towards sunset, you can really see it a little better. Hey, from the first thing you notice when you come onto this campus is this is a Norton hospital like you've never seen before. For one thing, you can take a look. It's only 2 stories tall there, so really getting lost, not going to happen. The parking is simple. It's all laid out around the hospital. Easy to get in and out. But really what's important to the folks here is how you feel when you get inside, and making, of course, a good experience for both the patient and the provider. That's what our Brooke Hash discovered.
People are getting excited. It's almost time.
Just days away from the grand opening, and Rachel McCleary might be one of the most excited of the bunch. She's a social worker at Norton Hospital downtown, but come November 11th, this will be her new office space.
We don't want it to be the normal, like I said, sterile environment. Don't want it to be too clinical. This is really a warm, welcoming environment because we want to create meaningful relationships with our patients.
From the comfy chairs in the waiting rooms,
this is our cute cafeteria, great natural lighting,
to the local artwork on the walls. This space was designed from the patient's point of view.
How would I want to experience something if I were to come stay in this hospital?
To feel more at home. If nothing else, you're much closer to it.
For some people, that means quite literally not having to walk 40 blocks.
Situated in the heart of West Louisville, it's the first hospital west of 9th Street in 150 years.
It's going to be huge. It's going to be life-changing. We're taking away, crucial care time. It takes you at least 15 minutes with traffic to get to the downtown Norton Hospital. When you think about the barriers to accessing health care, not everybody has a car.
Now, are we in the ER right now?
Yes, this is the ED. I have not seen the ED, so this is fairly incredible. Wow. So very centrally located nursing station, which is important. There's been a lot of questions about babies and if that's going to be something that we get to take part in. We will not have any labor and delivery, but we do have OB here. So women health, women's surgeries, that's going to be a focus here.
Which is so important when we talk about maternal health.
Crucial, yes.
The hospital's home to 20 inpatient beds.
Here we are in one of our patient rooms. This does not look like what you would see at any of our other facilities.
Just look out your window.
And that's really intentional because, when you're in a hospital, you feel really isolated. You're taken away from your natural environment. You don't get to see all the green spaces. And so that's something that we find really important to healing because we know that that's a part of the emotional healing, and you can't physically heal if you're not emotionally healing too.
That goes for staff too.
Oh my gosh, you all. This is incredible. Okay, wait, can we come out here? Why not? Oh, I love it. And then look at the view. This is so cool. Yeah, you can see the downtown skyline.
This hospital will not only significantly reduce the travel time during emergencies, but also for the everyday medical needs.
This is going to be our primary care for pediatrics and adults. So instead of having to, go out into the community and find these services, they are located right here in-house. You may come back next week for a primary care appointment. And if that's the case, then I can't wait to see you. I want to hear about how things have been and just do an emotional and mental check-in too. We know that West Louisville is an underserved, underprivileged community. Hopefully, we're going to see a increase in lifespan. We want to see a decrease in a lot of those chronic diagnoses that this community is experiencing at a much higher rate than the rest of Louisville. And so I understand the purpose of what we're doing at this hospital is much more nuanced and has a potentially greater impact than what we've seen before.
In West Louisville with Chief Photojournalist Philip Merle, Brooke Hash, WHAS 11 on your side.